Hey everyone, welcome to this week's What's Up Wednesday. My name is Rachel, and today I'm joined by Kelly Benshoof from Maida Project. Maida is a nonprofit organization focusing on mental health education. Welcome, Kelly. Thank you so much for joining us today.
Thank you so much for having me, Rachel.
Can you just get us started? Just tell us a little bit about yourself and your role with Maida Project.
Sure, sure. So I'm the executive director of Maida Project. I'm also a mom of three little ones, 5 and under. We live here in Evergreen, Colorado. And I'm really passionate about mental health and really addressing it and addressing the mental health crisis in different ways. The first way is reframing the way we think about it. Mental health really affects every facet of our life. And it really is the little things we do every day and the relationships we keep that nurture mental health.
I can't believe you have three little ones under 5. That must keep you very busy.
Yes.
Do you want to kind of just give us an overview about the Maida Project and kind of just introduce us to Maida, and then also just maybe an overview of how Maida could support childcare providers and caregivers?
Sure, sure. So Maida Project has its origins in work with a large child welfare agency called McKinley in Southern California. So what we saw there is firsthand how important it is to create cultures, organizational cultures that really focus on healing, well-being, building positive relationships as a way of promoting mental health from the ground up. We launched in 2019. Our mission is to address the mental health crisis by healing our connection to self, community, purpose, and the natural world. And there's such a need to invest in mental health beyond and outside of the healthcare system, outside of the doctor's office, the therapist's office. And so Maida Project exists to spread awareness, education, practices that nurture our mental health. And we know from decades of research how critical the early years of childhood development are. And the most critical area of supporting the young ones is truly, we believe, in supporting the adults who work with them. As child care providers are among the most burnt out field of professionals. And we really know how important it is for young children to have meaningful and trusted bonds with caregivers and adults. And so we really want to nurture that, the greatest resource for youth, and that is the providers, and to prioritize their health and well-being.
Yeah, thank you. Um, so childcare, I know you've kind of just touched on this a little bit, but childcare providers do play a critical role in children's development. How can enhancing their mental and emotional well-being contribute to creating a better caregiving environment?
Yeah, well, I really think that, my sense is that you're either enhancing well-being and by no fault of your own, but or you're not. And you'll see the downstream effects of not intentionally prioritizing it. And it doesn't mean it's easy to do the former. Our society is really not oriented toward nurturing mental health and well-being. It's not natural to us. So if there's turnover and sick days, these things are reflecting the chronic state of stress we're experiencing. One, thought experiment I find valuable, and I talk about this. If you consider how much it matters to nurture or enhance the mental and emotional well-being of children, and how much it helps them in their resilience building, their ability to, do hard things and go through hard times. We tend to think that adults are different, but we really need the same framework. That framework of intentionally working on our relationships, intentionally acknowledging the stress and burnout we're experiencing, and acknowledging that we really know that we can get through hard times, that it's part of our nature as humans, to go through hardship.
Yeah, yeah, you're right. And that is a good point there. We tend to focus on the little ones that we're working with, but it's just as important to focus on ourselves as well as their caregivers.
Yeah, absolutely.
Um, And I know you did mention how, childcare providers do often experience high levels of stress and burnout. Do you have any tips or resources to share on this topic of stress and burnout in general, or how can the Maida Project help to our childcare providers focus on that for themselves?
Yeah, absolutely. So, my real lived experience as a working mother, a nonprofit professional, and trying to wear all these hats. I think the greatest tip to kind of mention is we really do need to kind of get out of this binary thought process. Like we're either doing it really well or we're doing it really poorly. And the truth is, the reality is, we're doing it in an imperfect system. And there needs to be a lot of grace. So I offer that from my own experience. And second, while we can't change the culture or society overnight, we can equip ourselves with knowledge, and that is really important. Knowledge about our nervous system, the stress cycle, how we hold trauma in our body, things like that, and really start to discover a deeper connection to ourselves, to support our own regulation. It's really key. It's like working a muscle where we can begin to notice when we're getting activated or frozen. When we know more about our physiology, we can then have more it's just more information, so we can intervene earlier. And I think overall, a caregiving setting that acknowledges stress and burnout and explores the topic, will start to see a more healing-oriented culture emerge.
Yeah, yeah. Um, Are there any mindfulness or self-care techniques that you would recommend be geared specifically toward childcare providers or anyone who works closely with children, both for their own mental health and for the children in their care?
Yeah, so I think the more simple and hyper accessible, the better. Whatever setting you're in, a large, medium, or small setting. I really think it's valuable to reflect on and think about what works for the kids, and it is usually what works for the adults. Things like checking in, asking how a group is doing before moving into business. Building that in, baking that into staff meetings or group meetings that happen. I think that things like changing the physical environment, literally moving from one space to another, is a certain kind of nervous system reset. Things like walking and having a space that's just for being, that's not for business, but like, a kind of break space. And I think that things like breathing techniques are really valuable. I think that, all of these are served by that idea I mentioned before of really noticing, of being aware of one's own nervous system, of the group, sense, what we're bringing into the space, what we're going through. Just having that level of awareness, you start to see what kind of little simple practices can really change the way your own self-regulation can occur and how the group kind of can connect, and where you're really building a culture where it's okay to feel things, where we're humans, we're not machines. Things like that are really simple, can have a very profound effect on the culture of the setting.
Yeah, those are all really great tips, and I think a lot of us can learn something from that and have something to take away with today. So thank you. So for anybody who may be hesitant to prioritize their own mental well-being, whether that's due to uncertainty or feeling like they may not have the time or maybe just unintentionally, what advice or guidance would you offer to help overcome these barriers?
I think a lot of people, and we work at Maida Project in a lot of service-oriented organizations, with a lot of service-oriented organizations. Unfortunately, there's a lot of training we have from our own upbringing, especially with individuals who are very much interested in nurturing others, to deprioritize the self. And there's kind of a very overused metaphor about putting on your own oxygen mask first. But I think the really meaningful part of this metaphor is that our kids, if you must focus on the kids, you can remember the kids are learning from us at each moment, in how we model regulation, how we state how we're doing and what we do about it, how we communicate. It is, if we want our kids to build resiliency and build the capacity to move through life, and trying times, it is so critical that we embody caring for ourselves in front of youth. We want them to care for themselves in a nurturing way. We want them to care for each other. So I think, obviously our greatest barrier is time, right? That the time is a real issue. So I think that it's important to look at how you can integrate, some of these ideas and concepts, really build in pauses, check-ins, breathing, education into the existing structure. I think it's really key. And I think the greatest thing, a business owner, a provider, an educator can do, is prioritize it, is to really think about how can we prioritize this, and not in some big gigantic way, but in some little simple ways, throughout each day consistently, is absolutely how I would, recommend approaching that.
Yeah, I mean, you're right. Baby steps, right? It doesn't need to be,
Mhm.
waking up and changing your whole lifestyle in one day. You can take small steps towards becoming, or prioritizing our own mental health. And it's like you said about the oxygen mask. It's that saying, you can't pour from an empty cup, right?
Mhm. Yeah,
Yeah.
exactly.
For anybody watching who might work in a larger childcare center type setting, can you talk to us about the importance of creating supportive work environment? I know you kind of touched on that a little bit already, but what are maybe some things that they can put in place in a work environment type setting
Yeah,
amongst their colleagues?
sure. And it may seem obvious that we all want to create supportive work environments. And in reality and in practice, I just want to first acknowledge it can be really hard, to prioritize, mental health and well-being on the, organizational level, on the group level. Um, and there are so many demands. I know that early learning ventures exists to, support the industry in so many of the barriers and challenges that exist in running, different centers. And, I think that the number one thing any group can do, and especially in kind of larger settings, is to create some sort of dedicated space and time to talk about health, and to be, open to create the openness to talk about stress and burnout. Because if we pretend like they don't exist, we're never going to get ahead of the challenge. And sometimes just creating that intentional, dedicated space to acknowledge that we're experiencing stress and burnout, can open the doors, to really building a supportive work environment. On the same kind of topic, we learn so much from each other, and I think that we need to appreciate that. Everybody has a different story, different ways of coping or regulating, different ways of staying balanced and whole. And so if we start talking about these types of things, we can start practicing more. We can learn, from each other, and really honor space, for others to, uh, practice what works for them. If we don't talk about that, we might not be okay as a work culture for somebody to say, "Hey, I'm gonna go outside for a few minutes, and take a walk." Like if we can kind
Mhm.
of culturally, allow these things to emerge, it can really create a system that orients toward health, where we're really co-creating healthy environments. And I think that the most important part of this is to commit, having someone or some group in the organization commit to regular and consistent conversations like this.
Yeah, and that's great because in that type of environment, then you have each other as sort of, a support system, but then also for accountability's sake as well, and leading by example for each other and for the little ones.
Absolutely, absolutely. The accountability is really important. We see that in data about behavior change. That when we kind of are open and share, we're creating kind of systems of accountability where we're making something known in community, and that's really where you get a lot of creativity in how to improve something when you kind of open that up.
Yeah. Kelly, are you able to share any future goals or plans for the Maida Project or anything
Sure.
like that?
Yeah, absolutely. So we are expanding our programming every week right now. We're growing. We work a lot, like I mentioned, in service-oriented industries, in education settings, healthcare settings, community-based organizations, nonprofits, and even corporate settings too, to really like go in and provide education and skill building of how can we nurture health, how can we learn and kind of create these conversations, and build these skills. We do have a train the trainer program so that organizations can build their own internal expertise, and those internal experts can go out and disseminate this more empowering framework of health, this education, these skills, to really kind of build a shift in the organization. And what we're really excited about is to talk in this way about mental health and to share data and outcomes from our programs, so that we can start as a culture, as a society, to focus on mental health, at this kind of level of culture, in groups and family systems, caregiving settings, and organizations we're part of.
Awesome. Thank you for sharing. That's one of my favorite questions to ask. I love hearing about what's to come and goals for expansion and things like that. And so that's great. So if anybody had any questions or any want to learn more about the Maida Project, who can they reach out to, or where can they go to find out more?
Sure. So our website is lamaidaproject.org. And you can learn a lot about us there. You can email me directly. I'd love to hear from your audience and connect. My email address is kelly@lamaida.org, KELLY@LAMAIDA.org. We're on social media, so you can follow us and connect with us there. And we also have upcoming virtual workshops that are open to the public that anybody can join to get some basic education on mental health and basic skill building. And those are listed on our website under the events tab.
Awesome. Thank you so much, Kelly. Thanks again for being here today. Thanks for sharing all your knowledge and these resources. And it's been really great to learn all about the Maida Project. And I'm excited to share this with everybody in our network.
Thank you so much, Rachel. It's been a pleasure, and I hope that some of this information is beneficial to your community. And I really appreciate the opportunity.
Yeah, definitely. I think we all have learned something today, and maybe we'll go take a mental health break after this.
Yes, absolutely.
So thank you all for watching. Be sure to follow us on Facebook and Instagram and YouTube. Watch out for future What's Up Wednesday recordings. I will be sure to include all of the links and contact information that Kelly has mentioned in this video, so you know who you can reach out to and where to go to learn more. And I hope you all have a great rest of your day, and we'll see you next time. Bye.